Reducing nosocomial infections within the critical care setting using the Six Sigma model, the DMAIC process by Anaya, Ashley, Angie, and Victoria. This process stands for define, measure, analyze, improve, and control. To reduce nosocomial infections within the critical care unit, implementing practices such as proper hand hygiene protocols, ensuring the use of single patient rooms, and correct procedures for personal protective equipment such as gowns, masks, and gloves will help to reduce spreading infections. Using disposable medical equipment and thorough disinfection of rooms between patients are essential measures to limit contact transmission of infectious agents. Next, we have Angie speaking.
Thank you, Anaya. Nosocomial infection, also called the hospital-acquired illness, are infections that people get while in a hospital. There is a considerable risk to patient safety from this infection, especially in critical care units, where patients are immunocompromised and vulnerable to infection due to the severity of their illness and the invasive procedures they undergo. This infection can happen anywhere in the hospital. Still, they happen more often in critical care units because of the severe diseases treated there, the use of invasive devices, and the risk treatment that are done there. Cutting this infection is vital for patient safety, lowering healthcare costs, and improving results generally. Some strategies can be implemented to reduce nosocomial infections in the critical care unit, especially during the COVID-19 pandemic. Strict adherence to infection control practices, ensuring rigorous adherence to infection prevention and control measures, including hand hygiene, proper use of personal protective equipment, environmental cleaning and disinfection protocol, regular training and reinforcement of these practices among healthcare staff are essentials. About the hand hygiene, rigorous enforcement of hand hygiene protocol for all healthcare workers, patients, and visitors are essentials. Proper use of personal protective equipment such as masks, gloves, gowns, and eye protection to prevent the spread of infection. Regular and thorough disinfection of surfaces and equipment in the critical care unit. We should screening patient and staff for COVID-19 symptoms every day to prevent cross-contamination. Antimicrobial stewardship, we should use sometimes antibiotics to prevent the development of resistant strain of bacteria. We should continuous education and training of healthcare staff workers on infection control practices. We should limiting visitor access to reduce the number of people in the unit and potential sources of infection. Also, ongoing monitor of infections rate to identify trend and sources of the infection. We should ensure adequate ventilation and air quality within critical care units to reduce the risk of airborne transmission of respiratory pathogens like COVID-19 by using some filters. About the patient care practices, adherence to evidence-based practices for invasive procedures, such as central line insertion and ventilator care to minimize the risk. We can improve nosocomial infection in the critical care setting by using the DMAIC approach of define, measure, analyze, improve, and control. DMAIC will allow us to identify opportunities, collect data, analyze root cause, implement improvement, and establish control measures to sustain those improvements. An example of application of DMAIC can be seen in through the use of Six Sigma, which refers to a data-driven methodology for process improvement, focuses on reducing defect and variation in process to achieve better outcome, utilizes statistical tools and techniques to analyze and improve processes. The Six Sigma refers to the statistical means of process performance, indicating a process that operates with extremely high precision and reliability, allowing only 3.4 defects per million opportunities. In addition to the previously mentioned work standardization, we can also bring about improvements by using DMIC approach of define, measure, analyze, improve, and control, as we systemically apply its principle. DMAIC will allow us to identify the opportunities, collect the data, analyze the root cause, implement improvement, and establish control measures to sustain those improvements. The key principles of Six Sigma include focuses on customer requirement and satisfaction, use of data and statistical analysis of decision making, and also emphasize in process improvement and waste reduction. Also cross-function teamwork and collaboration, and leadership, commitment, and support. By following the DMAIC approach, healthcare team can systemically identify and address factors contributing to nosocomial infection in the critical care settings, leading to improved patients' outcome, reduce healthcare costs, and enhance patient safety. Now, we will listen to the 5 whys of the problem with Ashley.
Thank you, Angie. We can use the 5 whys in problem solving to aim to identify the root cause of nosocomial infections in the ICU. First, we start by identifying the problem, which is nosocomial infections in the ICU. Then we can ask why for the first time. In our case, it's because patients in the ICU have compromised immune systems and are more susceptible to infection. By asking why several more times, we can eventually get to the root cause. Patients in the ICU use more invasive medical procedures and devices, which can increase the risk of bacterial colonization. Well, why? This can be because there may be a lapse in proper sterilization and disinfection protocols for medical equipment and devices. Well, then you can ask why again. This could be due to inadequate training or supervision of staff responsible for cleaning and disinfecting procedures. And final why to our situation could be because of a lack of standardized protocols or guidelines for cleaning and disinfecting equipment in the ICU. Now that we have the root cause of nosocomial infections in the ICU, what are some countermeasures that could help reduce our problem? Well, by implementing rigorous training programs for ICU staff on proper cleaning and disinfecting techniques, developing and encouraging standard protocols for cleaning and disinfecting medical equipment in the ICU, increasing supervision and monitoring of cleaning practices to ensure compliance with protocols, utilizing advanced disinfecting techniques such as UVC lights or hydrogen peroxide vapors for enhanced sterilization, and finally, conduct regular audits and quality assessments to evaluate the effectiveness of infection control measures within the ICU can all help reduce nosocomial infections within the ICU. I will now turn it over to Victoria, who will be discussing a hypothesis to nosocomial infections in the ICU with expected actual outcomes and a case study. Thank you.
Thank you, Ashley. In a 2017 research study conducted by the King Fahd Hospital in Saudi Arabia, researchers and clinicians worked together to study the effect of the Six Sigma DMAIC approach to reducing nosocomial infections in the critical care setting, hypothesizing that the rate of nosocomial infections will significantly reduce upon implementation of this process improvement method. The goals of this study were to state the parameters of each phase, define, measure, analyze, improve, control, identify preventative measures such as proper sharps and waste handling and disposal, sterilization of instruments, food and water precautions, hand hygiene protocol, use of personal protective equipment or PPE, and reduction in the number of visitors and isolation rooms to ultimately reduce the rate of nosocomial infections. In the define phase, the problem and the scope of the project are addressed, which acknowledge the incidence of nosocomial infection in the ICU and the attempt to reduce this incidence rate using this process improvement method and the aforementioned preventative measures. In the measure phase, a baseline for the occurrence of nosocomial infection was calculated, data was collected through reporting, and possible causes and contributing factors were identified, such as lack of knowledge of policies and protocols, poor hand hygiene, and insufficient staffing and time. In the analyze phase, a root cause analysis and cause and effect diagram were carried out for each reported case of infection. In the improve phase, improvement strategies were brainstormed and implemented by hospital stakeholders based on the data analyses. In the control phase, those strategies were statistically monitored to ensure control and periodic audits were conducted. The results found that the difference between the baseline and the post-intervention rates of nosocomial infection were statistically significant, concluding that the application of the Six Sigma DMAIC approach significantly reduced the nosocomial infection rate in the clinical care setting, which aligns with the expected outcome. I will now hand this off to Anea, who will conclude this presentation by discussing lessons we've learned, recommendations, and next steps.
Thank you, Victoria. Our summary. Based on the provided parameters and approach, it can be concluded that the implementation of the Six Sigma DMAIC approach effectively reduced the rate of nosocomial infections within the critical care setting. The results show that this approach led to a significant reduction in the nosocomial infection rate within critical care settings, meeting the expected outcome. Therefore, it can be concluded that the approach was successful in achieving its intended goal. Lessons learned. Structured approach, clear goal setting, root cause identification, and strategic improvements. Strategic approach. DMAIC provided a structured framework for addressing the issue of nosocomial infections. Each phase allowed for a systematic approach to problem solving, ensuring that all aspects of this issue were thoroughly examined. Clear goal setting. The defined process helped in clearly defining the goal of reducing nosocomial infections, ensuring that efforts were focused on a specific outcome. Root cause identification. Through the analyze phase, root cause analysis and cause and effect analysis were conducted to identify the underlying factors contributing to nosocomial infections. This allowed for targeted interventions to address the root causes rather than just treating symptoms. Strategic improvements. The improvement phase involved implementing improvement strategies based on findings of the analysis. These strategies likely targeted specific areas identified as contributing to nosocomial infection, such as hand hygiene practices, antibiotic usage, or environmental cleanliness. Recommendations. Infection prevention, which includes hand hygiene, is one of the most effective ways to prevent the spread of infections, including the nosocomial infections. Proper hand washing can significantly reduce the transmission of pathogens between patients, healthcare workers, and the environment. Patient well-being. Patient bathing helps in maintaining cleanliness and hygiene, reducing the risk of infections. It can also contribute to the overall comfort and well-being of patients, enhancing their experience during hospital stays. Surveillance. Surveillance helps prevent early detection and monitoring of the infections within healthcare settings by actively tracking infection rates and trends. Healthcare facilities can implement timely interventions to prevent outbreaks and minimize the spread of infections. Environmental cleaning. Proper cleaning and disinfection of healthcare environments are essential for preventing the transmission of infections. Contaminated surfaces can serve as reservoirs for pathogens, leading to the spread of infections among patients and healthcare workers. Effective environmental cleaning practices help in reducing this risk. Next step. Continued monitoring. Surveillance of infection rates and trends should be maintained to ensure that implementing strategies remain effective over time. This involves ongoing data collection and analysis to identify any emerging patterns or areas for improvement. Education and training. Healthcare workers should receive ongoing training and education on infection prevention and control practices. The importance of hand hygiene and environmental cleaning cannot be stressed enough. This helps to ensure that staff members are knowledgeable and compliant with recommended protocols. Quality improvement initiatives. Continuous quality improvement initiatives can help to identify areas for further enhancement in infection and control practices. This may involve conducting audits, soliciting feedback from staff and patients, and implementing targeted interventions to address specific challenges or gaps. Adaptation to emerging threats. Healthcare facilities should remain vigilant and adaptable to emerging infectious disease threats. Preparedness plans should be in place to respond effectively to new challenges as they arise. By taking these next steps, healthcare facilities can build upon the progress achieved in reducing nosocomial infections and further strengthening their infection prevention and control efforts in the critical care setting. Thank you for listening to our presentation by the Fab 4 Females.